45% of all direct restorations are Class 2. Performing them efficiently and reliably is essential for the satisfaction of your patients and the profitability of your practice. That's why Dentsply Sirona created the Class 2 Total Practice Solution, providing all the products, education, and support you need to maximize Class 2 success. In this procedure, Dr. Alan Atlas will restore a distal occlusal cavity on tooth number 13. Dr. Atlas uses the Class 2 portfolio of products to protect the vulnerable interface of the proximal box and to achieve efficient aesthetics when finishing the restoration. The procedure begins with administration of 4% articulant anesthesia. While waiting for onset of the anesthesia, you can place a Paladin V3 ring. This creates separation between the teeth to facilitate placement of a Paladin Plus wedge guard. The wedge guard is placed interproximally, shielding the adjacent tooth from potential burr damage and allowing Dr. Atlas to prep the restoration more quickly. Dr. Atlas uses an electric handpiece at varying speeds and a specific sequence of diamond burrs. Initial preparation is done with a medium grit small cylinder diamond. The dentin is then finished with a fine grit, modified shoulder diamond. The enamel is finished with a fine and superfine grit bullet-shaped diamond to ensure optimal adhesion and composite placement. With the cavity prep completed, a Paladin V3 matrix band and ring are placed to establish the restorative field and separate the teeth, providing the space needed to create accurate interproximal contour and tight contact. Although this case is a single two-surface restoration, the Paladin V3 sectional matrix system is also versatile enough to use for multiple restorations simultaneously. In a second case, Dr. Atlas uses 2 rings and matrix bands to restore a mesial occlusal and distal occlusal cavity simultaneously on tooth number 14. The Paladin V3 ring is designed to stay in place with exceptional stability, and the matrix band is contoured to provide an anatomically accurate form for placing restorative material. The ring tines are V-shaped to fit perfectly with the 3 sizes of the Paladin V3 wedge. The wedge slides in easily to create a tight seal of the gingival margin. And the Paladin V3 ring ensures adequate separation for a strong, broad contact. After assessing the amount of available enamel, Dr. Atlas chooses a selective etch technique using a microbrush loaded with Detray Conditioner 36. After conditioning the enamel for 5 to 10 seconds, the Detray Conditioner 36 is rinsed away. Dr. Atlas uses the high vacuum suction tip directly over the preparation to adequately dry the dentin and enamel for 5 to 10 seconds, while avoiding desiccation of any dentin that may have come into contact with etchant, especially at the dentin-enamel junction. Universal adhesive is applied using a 20-second scrub to create a strong bond. Before light curing, Dr. Atlas air dries the universal adhesive for 5 to 8 seconds with an air-only syringe. Dr. Atlas uses Dentsply Sirona's SmartLight Pro curing light to cure the adhesive for 10 seconds. The SmartLight Pro curing light provides excellent intraoral access and convenience with a curing tip that rotates 360 degrees to easily reach any position in the mouth. With the adhesive cured, Dr. Atlas uses SDR Flow Plus material to bulk fill the cavity. He avoids lifting the tip out of the material while dispensing, gradually withdrawing it when 4 millimeters of material have been placed. The 4 millimeter bulk fill depth eliminates the need to use a time-consuming layering technique. SDR Flow Plus material self-levels in a few seconds and provides excellent adaptation to the floor and corners of the proximal box, helping protect the most vulnerable interface of the restoration. The SDR Flow Plus material is cured using the SmartLight Pro curing light for 20 seconds. With a large 10 millimeter active curing diameter and excellent beam collimation, the SmartLight Pro curing light provides reliable curing to the full width and depth of the restoration. Even over larger distances, there's no worry about incomplete curing. The restoration is finished with Ceramex Spectra ST Universal Composite. Ceramex Spectra ST Composite incorporates SphereTech filler technology to provide optimized handling in the user's choice of high or low viscosity. The unique construction of SphereTech fillers also enables an enhanced chameleon effect that covers the entire Vita range using only 5 universal cloud shades to easily match the aesthetics of the surrounding tooth structure. The final restoration is cured using the SmartLight Pro curing light. The matrix system can now be removed. Notice how the matrix band has remained snug between the teeth throughout the procedure, ensuring tight contact and natural contour with minimal flash to clean up. Dr. Atlas uses a fine and superfine grit diamond burr at low speed with water to shape the marginal ridge. Ceramx Spectra ST composite starts to polish and smooth nicely as it's being adjusted. The last step is to finish the restoration. Using the enhanced finishing system, Dr. Atlas begins by applying more pressure to remove excess material, then uses a lighter touch to achieve a smooth, contoured final surface with a natural-looking finish. After the restoration is complete, this case presents some minor bleeding. Dr. Atlas applies Hemoband Gel 25% aluminum chloride hemostatic solution. Hemoband Gel solution can be used at any time during a Class II procedure if bleeding occurs, as it is easy to apply interproximally using the convenient infuser tip. With the bleeding managed through an astringent effect, Hemoband Gel solution rinses away with no residue. The Class II Total Practice solution delivers highly effective restorations with great radiopacity, excellent cavity adaptation at the floor of the proximal box, accurate interproximal contact and contour, and efficient aesthetics. Discover a more efficient and predictable Class II procedure with the assurance that you're providing an elite level of dental care. Learn more clinical techniques and request a demo of the Class II Total Practice solution at dentsplycerona.com.